Hey guys, Don here. Welcome to Podiatry Practice Mastery. We're helping you get to the $1 million mark and beyond. So I am recording day 14 of my ModMed transition, and I had my first kind of good day. It was I was able to get to the level office visit for all of my patients, and more importantly, Murali did I think probably 80% of my notes, and he was able to have an hour lunch, which is a good thing for him. And I was able to get home kind of on time, which was a good thing. So we're doing good. I actually was able to write down what I did here, so hopefully we can get back to doing these things for you. Okay, first patient, and I have a different tracking system. I'm not printing out my list anymore. I'm just kind of writing things down. So I may have forgot a few, but here are my shorthand notes. First patient was a 54-year-old female, got referred from another doctor for an accessory anosporonium bone that was painful, didn't want to remove it, didn't want to do cortisone, wanted Shockwave. Shockwave number 3 of 6, starting to feel better. Next was a 55-year-old female, left plantar fasciitis, got an x-ray, got an ultrasound, got her a night splint, and set up 3 sessions of Shockwave, went over the difference based on the ultrasound. If there's a lot of thickness, I tend to think that Shockwave works better. If there is not thickness, then I think cortisone works okay. So she opted for the Shockwave, and we started out with Shockwave number 1 for her. And I think I said 3, but I said probably between 3 and 6. So I don't remember how many I set up for her. Next was a 55-year-old female, status post, left hallux nail avulsion after 3 months. The nail is growing back. It was a retronychia, kind of swelling at the nail base region. Wasn't really responding, was that way for months. And so after avulsing it, everything looks good. The nail looks a little bit dystrophic and thickened. And so I just did an office visit for that. And I did not look fungal, so I didn't do a nail sample. But we'll just see her back in 6 months if needed, if there's any abnormalities of the toenail. I talked about doing either Onifix on there to kind of flatten it out. And I talked about doing Cariflex as well to make it look pretty. But she said she was just going to use a Band-Aid during the summertime. Next patient was a 65-year-old male, left plantar fasciitis, Shockwave 1 of 6. I did an ultrasound. He also has a little bit of neuropathy, so I talked to him about that. Next was a 76-year-old female, level 3 visit. She had a right shin splint. She got a lot better after her first Shockwave to the shin splint, and she actually has some knee issues, like a Baker's cyst issue, and she kind of thinks that the knee might be contributing to it, and so we're actually going to hold off on doing the Shockwave, not because she's better from the shin splint, but it could be merging more from the knee region. Next was a 55-year-old man, Shockwave number 1 out of 6 for fibular, AVN / says I think it's a fracture or an AVN of the sesamoid, and I'm wanting to try to avoid removing it, so we're going to do that, and if that doesn't work, he is aware that we would remove the sesamoid. Next was a 55-year-old female for a nail sample, and she got the terbinafine and also the fungal nail kit, and I'm actually doing better now because Murali, he actually can send the medications out as well with this new medical record, so we can send out medications. He learned how to set up the electronic pharmacy, and he can send out LFTs, so he did that, and they got the fungal kit as well, which is the Steri shoe spray in the biotin. Next patient, 42-year-old EPAT number 2 out of 6. This was the PCP, she's a PCP locally for plantar medial heel pain. Next was a 70-year-old female, did an ultrasound, and she did a cortisone. The reason she's doing the cortisone is that even though there was thickness in the fascia, she's going to be going to France for her vacation, and due to the pain, we are doing a cortisone injection. And then I told her possibly if the pain comes back in 6 to 8 weeks or 3 months, up to 3 months, then we would do the Shockwave at that time. Next was a 54-year-old failed Lamisil, wasn't really clearing out, and so I switched that to Diflucan. So that was a level 4 visit for the medication management, and then doing a 6-month follow-up as well. I put a Cariflex on that patient as well. Next was a 64-year-old female, fifth met, had a porokeratoma / wart, and I made a template for porokeratoma / wart in my ModMed, so it's a lot easier for Murali to do that. Next was a 74-year-old man for Qutenza number 2, and he wanted a diabetic shoe prescription, so I did that. Next was a 14-year-old female, status post-Lamisil, actually after the booster, so they were here after about 9 months, looking much better. And they had like on the left hallux, left fifth digit, it was nice and flat and clear. On the right one was a little bit thickened. I tend to find all little toes tend to look a little funky, and especially this one because it was a little bit curved, like not really ingrown, but just curved on the edges, and those tend to rub and cause thickening. So I just kind of clarified that with her, and they were okay without doing any other medication. Next was a 56-year-old female bilateral hallux limitus, and she wanted treatment. We talked to her about her x-rays, about first ray elevatus, about orthotics, about this and that. She's not having a lot of foot pain, but she's going to be going on vacation, so I did a cortisone injection to the first MPJ, and it hurt a little bit. Those tend to hurt. I did it with ultrasound guidance, and she still hurt. I think it's the fluid that goes in there that hurts more so than anything. And if anyone has any good ways of making first MPJ injections for hallux limitus hurt less, let me know. Maybe I could have numbered it up before. She said that she had one from another doctor and had no pain, and I was thinking to myself, maybe they didn't go into the joint. They might have just kind of went around the joint, I'm thinking. But I tend to have these patients, they hurt quite a bit, and they sometimes even pass out because of the pain. It hurts that bad. But maybe, I don't know, maybe I'm doing something wrong. If you know something different, let me know. Next was a 52-year-old for a wart. I did cantharidin. Next was a 68 for Qutenza number 1. For this one. Next was a 39-year-old MRI follow-up for a peroneal tendon injury. That's kind of getting better, so I did not advance this. I said if it continues to get worse, we would do the Shockwave for him for that peroneal tendon, but it's not hurting him that much. And the last patient of the day was a 33-year-old female for number 5 out of 6 plantar fascia. For plantar fasciitis for Shockwave. So it was a good day in the office. As you can see, as I'm just noticing I didn't do any orthotics. I tend to like to do 2 orthotics per day, so I wasn't kind of doing that. I think I'm getting back into the groove, so everything else seems to be going a little bit better. I'm listening to a good podcast, which I like, is Alex Hormozi, and he had a kind of a good one on mindset today, kind of saying, if something's not going to matter like 3 months from now, or even 3 years from now, like try not to let it bug you that much. And I know it's something, when things happen, you kind of get a little bit worried, but I think having that kind of long range perspective of things. I was just thinking of this because, we've talked over time about my dad. He's going to like the adult daycare and dealing with dementia, the new EMR transition, and all these other things. They're important now, but they're going to be less important in 3 months, and they're going to be less important than that in 3 years. So trying to kind of keeping that as a perspective. So I think that's something important for us in our lives as podiatrists and also as people in general. So hope you guys found this beneficial. I did get 2 people that were interested in I'm putting together a small group mastermind. If you are interested, and a couple have reached out to me in WhatsApp, but if you want to reach out to me via email, shoot me an email down at podiatrypracticemastery.com. I'm thinking it's going to be like a small group. I'm still trying to figure out the best time, because time is the hardest thing. I'm almost thinking it's going to have to be like the first time slot in the day from like 8 to 9, because I'm not really willing to give up nights and weekends. So I'm thinking like 8 to 9 in the morning is going to be the best time. But I don't know if that'll work with everyone if like you're in different time zones. But that's what my thought is. I think it's a good investment in working on our businesses. So let me know if you're interested. Shoot me an email down at Podiatry Practice Mastery. Once again, thanks for listening. Until next time.